Tabelecleucel, as we can call it shortly, is a very important substance. These are off-the-shelf T-cells, meaning that these T-cells have been collected from third-party donors which are not family members or in a stem cell registry. And these T-cells from donors who have had in their life already infection with the Epstein-Barr virus, they can produce antibodies. And we have patient cohorts, especially after transplantation, either solid organ or stem cell transplantation, who do receive, of course, long-term immunosuppression to avoid organ rejection and graft-versus-host disease. And by giving these immunosuppression, they are, of course, prone at risk for developing other malignancies, because the immune system, which should work or act against these infected cells or malignant cells, is blocked. And by collecting these EBV-reacting leukocytes from a donor, you can then separate these cells. You can stimulate the B cells with virus proteins, and then they transform to antigen-presenting cells. Then when you co-culture those B cells with the T cells, then the T cells will proliferate, and finally you will have a culture with cytotoxic T cells, which are then not alloreactive. And these T cells get then characterized and are put in a library on the shelf. And when a patient in need arises, you select from this library tissue specific T-cell. So you check just the HLA system and look for a similar HLA system in the library, and these cells then can specifically recognize the infected cells in the patient and can lyse these cells. And the good thing is that the response rates of these patients are significantly better than we do have this when we give just chemotherapy or immunotherapy with antibodies. And in the talk at the EBMT, I focused on patients with central nervous system lymphoma, who are really one of the poorest patients because they do not respond to routine therapy. And we were able in 4 pooled studies to identify 18 patients with a median age of 22 years who developed post-transplant EBV lymphoma, 10 of them after solid organ transplant, and the majority of those patients had received a kidney transplant. And most patients have received prior therapy, either a CD20-directed therapy or chemotherapy, but did not respond, and were then selected or included in one of those 4 studies. And the administration of the cells works in cycles. Patients receive 1 cycle consisting of 3 infusions on day 1, 8, and 15. And then you monitor the response within 35 days and give another cycle if you achieve at least a partial response. If there is no response, you can select a different product from the library with a slightly different HLA system. And our patients achieved in 14 patients, we achieved an objective response. 7 of those patients had a complete remission and 7 a partial remission. So nearly 80% of those patients responded to this novel therapy. And the 1 and 2 year overall survival was, of course, longer in those patients who who achieved a response to this new treatment option, Tabelecleucel, which has been achieved marketing authorization last year already. So currently we are still working on the results of the studies, which are still ongoing. Side effects of the treatment, which is also an important fact, are so we had not observed any serious treatment emergent adverse events so far, which is a very good outcome for those patients.